Tonight, we're revisiting some of the predictions that were made a year ago, just before the COVID outbreak forced the nation to lock down. We spoke then to a professor of epidemiology at Harvard. CBS's Jim Axelrod revisits the health expert again tonight to talk about his projections for the next year.
If the images from a year ago shocked, stunned, and brought the country to its knees, then Harvard epidemiologist Marc Lipsitch has a new picture to paint about COVID.
It won't be gone, but I think we'll be in a much more normal place in the fall.
A striking contrast to the dire projection he made this time last year.
200 million adults, 40% becoming infected, yeah.
So 80 million
There's a
people.
lot of people, yes.
Turns out he was right. The CDC estimates at least 83.1 million Americans have been infected so far.
How did the United States do compared to the rest of the developed world?
It's on the worse end.
Compare the U.S. to Pacific Rim countries that took unified, intense control measures early and didn't argue about masks, distancing, and testing.
And the lesson there is that aggressive early action will reduce the intensity of the spread?
I think that's the lesson, and I think that action requires this national, very focused leadership. We really do hold our own fate in our hands.
Not that he's sounding the all clear, not with variants lurking.
I think the variants are concerning. It appears that immunity to severe disease probably is more robust than immunity to infection, and so the hope is that vaccines will still be good at protecting us against severe disease and death. If the vaccines really are as protective against transmission as we hope, it's going to be like flu, but it's not something that changes our lives as a society.
Which, after the last year, is the kind of projection we can live with much more easily. Jim Axelrod, CBS News, Cambridge.